This segment of Delmarva Life is brought to you by TidalHealth.
Working together to ensure all communities on Delmarva have equal access to health care. That's the purpose of something called the REACH Project. And we'd like to welcome to Delmarva Life the Interim Chief Nurse Executive and Vice President of Population Health at TidalHealth. This is Dr. Kathryn Fiddler. Good afternoon.
Good afternoon.
How are you today?
I am great, thank you.
Okay, well, let's just start off with the REACH Project. What is it?
So it stands for Rural Equity and Access to Community Health. And we were awarded, as part of a law that went into effect last year, part of pursuing health equity, $1.1 million to support organizations here on the Lower Shore, improving health disparities. And we're going to actually focus on hypertension and diabetes here on the Lower Shore.
So what is health equity?
So that's an interesting question. So health equity is really allowing each of us to get the most out of our healthcare experience so that we can all have great outcomes. What we've seen, and we've seen this a lot more recently because there's been a lot more research done, but individuals who, depending on their social status, depending on some of their lack of access to social things like transportation, internet, safe housing, have poor outcomes. So they may not live as long, they may have more diseases, more chronic diseases, more exposure, more admissions to the hospital and emergency department visits because of their health care, because of that lack of access. I want to give you one example for health equity because it is kind of hard. Like, what does health equity, does it mean we all get the same thing? So one of the best examples was a t-shirt example. So imagine that I was giving out t-shirts from TidalHealth and everybody got a t-shirt and we all got extra large. That would be great. For some people it would fit perfectly. For other people it may be a dress. For some people it may not fit at all. But what we would want to provide would be a t-shirt that fits each and every one of us. I know it's a simple example, but I think sometimes people, health equity sounds a little weird, and what does that mean? It means giving each one of us what we need for the best of our health.
Sure, sure. Okay, so do you find that a lot of areas on Delmarva are underserved?
We do, and we know that we have some of the highest poverty rates here on the Lower Shore, especially Somerset County. What we've done is we really looked at the disparities for those two diseases, for hypertension and diabetes, and what we found is 5 zip codes in our Lower Shore, Princess Anne, Eden, Pocomoke, Snow Hill, and Salisbury, have the greatest disparities between Black and people of color and other races. So we really want to make a concerted effort to focus on those areas where we see the greatest disparities.
So this grant will help those particular areas?
It does. We're doing it in three sort of ways. First is the individual. So we're going to work on the individuals that we know, whether they're in providers' offices where we're already providing care, or other of our community partners, Chesapeake Health, our health departments, Atlantic General Hospital, as well as TidalHealth are working together. We also are working with Mosaic and several other small organizations on the shore. UMES is a great partner to figure out who do we need to reach from an individual level. Then we're going to work on community level, like outreach events, some of the things that we're doing like at MAC next weekend that you'll hear more about in the coming weeks, and outreach events, prevention and planning. And then we're going to look at system level things. How do we translate better? How do we use some of our technology better? How do we take our electronic medical record and use it throughout the community? So a lot of different interventions at a lot of different levels.
So what kind of activities will the grant support?
So one of the best ones is we have community-based chronic disease management education that's free to the community. Right now it only comes through MAC, but many of our Lower Shore partners, including our health departments, AGH, some of our Haitian development centers, and other areas on the shore provide these same classes. So we want to make sure people know how to get engaged in them and enrolled in them. We see great success with them, lowering of hemoglobin A1Cs, lowering of hypertension, and less disease states for the folks that participate in these programs.
Sounds wonderful. So how can the community get involved?
The best part is just look and listen as you learn, as you hear REACH talked about, as you see signups for these chronic diseases. Many of us on the Lower Shore experience chronic diseases, especially diabetes and hypertension, and that's a problem for all of us. So talk to your friends and neighbors, tell them that these classes are out there, reach out to your primary care physicians who are going to be well educated on the programs throughout REACH, but talk to each other and just get involved.
Yeah, sounds like a wonderful program. Dr. Kathryn Fiddler with TidalHealth, thank you so much.
Thank you so much.